Welcome to the Vibrantly You podcast. We're your hosts, Megan Martineau
and Caitlin Cipriano. In this podcast, we talk about fitness and nutrition on your motherhood journey. Whether you are trying to conceive, pregnant, postpartum, or beyond, you are welcome here.
Nothing is off limits, and our goal is to support you in this important season of life so that you can feel vibrantly you. As a reminder, this information is not medical advice. Please see the show notes for more details. Welcome back to the Vibrantly You podcast. Today I am doing a solo episode and we are going to be talking about something that I see many people complaining about in pregnancy, which is SPD. So let's just jump right into this. What is SPD? SPD is a type of pelvic girdle pain, and it stands for Symphysis Pubis Dysfunction. Now, this is the kind of pain that occurs at the front of the pelvis at the joint called the pubis symphysis. This joint connects the right and left pubic bones and aids in the stability of the pelvis as well as shock absorption. So during pregnancy, the ligaments are stretching and lengthening due to the hormone relaxin, and so this combined with a lot of the postural shifts that are happening in pregnancy, as well as the extra weight in the belly. And, the belly is continuously growing. So this is something that's constantly changing over the course of pregnancy. This obviously can contribute to some instability in the pelvic joints. Now, SPD can be something that is very debilitating. I actually had this in both of my pregnancies, so it's something that I take very personally. So with my son, it first occurred around 30 to 32 weeks. I can't exactly remember when it started, but I do remember that I was doing a workout. I was finishing up on the floor. I think I was doing some glute bridges specifically. And when I went to go stand up, I immediately felt this horrible, sharp shooting pain in the front of my pelvis. It literally felt like it was breaking in half. It was horrible. I could not walk without pain. I really couldn't do much of anything, honestly, besides like sitting. And of course, I didn't know what this was at the time. So when I went to see my doctor at a regular prenatal appointment, she told me, oh, that's normal. That happens in pregnancy. And I was like, I'm sorry, what? Like, I still have 8 to 10 weeks left of my pregnancy. What do you mean? Thankfully, they did refer me to pelvic floor PT, but it took me a while to get in, to be seen by someone because this was also COVID times. And I really wasn't able to get in, I think, until the last 3 to 4 weeks of pregnancy. And so at that point, there wasn't a whole lot that we could do to relieve things for me. Thankfully, once my son was born, that pain pretty much disappeared as quickly as it had come on. And so I didn't really give it another thought. I was just like, oh, that was a thing that happened to me during pregnancy. Then when I got pregnant with my daughter, I knew ahead of time, I was probably going to deal with this at some point, but I was floored when I first felt the twinges of this around 18 weeks, because that's so early. And to be honest, like I said, I was not expecting it until the third trimester. So I was like, crap, totally took me by surprise. And I knew that I needed to get ahead of it if I wanted to be able to get through my pregnancy without agonizing pain and actually enjoy my pregnancy, have an active pregnancy that I was hoping for, because I wanted to have a VBAC. And that's what I'm going to be talking about in this episode, is ways that you can kind of get ahead of this pelvic pain, and then also ways that you can deal with it and reduce it once it comes on. Because here's the thing, pelvic pain in pregnancy is common. We hear this a lot. It's something that is expected, and it does happen to many people, but this does not mean that you have to suffer and deal with it up until the day that you give birth. There are many things that you can do to reduce the pain and discomfort. There are also things you can do ahead of time to reduce the chances of this happening or happening in a more severe way that still allows you to exercise, walk, and move throughout your pregnancy without pain. So before we dive into this, I do want to mention that SI joint pain is also a common complaint in pregnancy and tends to get lumped into that pelvic girdle pain. This is the pain that occurs in the back of the pelvis at the SI joints, and we did do an episode on this already. So if that is something that you're dealing with, go ahead and listen to episode number 15, which talks about that specifically. But I will say that the strategies I talk about in this episode will also help with SI joint pain. So you will find these valuable as well. So my guess is that if you are listening to this right now, you are likely suffering from SPD, or you had it in a previous pregnancy, you're wanting to get on top of it, or you're wanting to just do something now to help reduce the pain. So let's start with some lifestyle changes that will help bring you some relief. First thing I want you to do is stop crossing your legs when you sit. This is something so many of us do. It's typically a comfortable position. However, if you're already experiencing pelvic pain, we want to uncross those legs because that does pull the pelvis out of alignment a little bit. And if you're already dealing with some laxity in those joints, we want to try to stabilize that pelvis and not pull it out of alignment. Second thing, avoid wearing heels. I don't think many people are wearing heels in pregnancy. Maybe you are. But if you are someone that's wearing heels, I would ditch them. Not great for pelvic pain. When you go to get dressed, so like putting on pants, underwear, when you go to put on your shoes, rather than like hobbling around on one leg to put your shoe on or, loop your leg through your pant hole, instead sit down to get dressed. This is going to reduce all of your weight being on one leg, which again shifts that pelvis and can aggravate that joint. You're also going to want to think about standing with your weight evenly distributed in both feet rather than sinking into one hip. So a lot of us, when we're standing, we kind of shift to one side, right? Like shift into one hip. And so then your weight is not evenly between both feet. It's like a little more in one foot than the other. Pay attention to this. See how often you're doing this. Instead, try to shift that weight so it's evenly distributed in both feet. Again, that's going to help to stabilize your pelvis a little bit. Be mindful of how your pelvis is when you're standing, specifically avoiding tucking under. A common posture in pregnancy is tucking the pelvis under and kind of like shifting forward. That's going to put a lot of pressure on the front of the pelvis. So just being mindful of how you stand and trying to untuck that pelvis and have a more neutral position. So think about having your rib cage stacked over your pelvis is going to be helpful. And then lastly, sleeping with a pillow between your knees. And then when you go to roll over in bed, because this can also be something that's pretty painful for people who have SPD, when you go to roll over, squeeze your knees together into that pillow when you roll over, and that will provide some stability. So those are some lifestyle things that you can do on a daily basis that will help with that pain. But now let's talk exercises because yes, you can still exercise with SPD. You just have to change your approach slightly. So the number one thing is going to be at the first sign of that pelvic pain, you're going to want to reduce single leg weight bearing exercises. Again, anytime you have the majority of your body weight on one leg, it's going to aggravate those joints because we're seeing extra like friction and movement there. So instead, you're going to want to switch to bilateral lower body exercises. So for example, instead of doing reverse lunges, doing some squats, you could even try out a split squat because your weight is still in both feet. It's not just all in that front foot if you're doing a reverse lunge, right? Or like avoiding side lunges, really lunges of any kind. Try to do bilateral lower body exercises. If you are doing glute bridges and hip thrusts, even squats, sometimes putting a loop band around your thighs can be helpful because that's going to engage your outer hip, provide a little more stability for you. Working on hip strengthening is going to be great. Again, we want to think about how can we stabilize the pelvis. We can't do anything about joints. We can't do anything about bones, but we can strengthen the muscles that surround these joints and bones, and that's going to help to provide some stability. So hip strengthening is great. Also thinking about your adductors. So your adductors are your inner thighs. If you visualize the pelvis, the inner thighs come up and connect right where that joint is, that pubis symphysis. So if you have, say, your left inner thigh is a lot tighter than your right inner thigh, that can be pulling on that joint and cause some instability, cause some uneven pulling there. So you might need to work on relaxing one inner thigh, strengthening the other one. This can be a little tricky because it varies person to person. Some people need more release work. Some people need more strengthening. Some people need a combination of both. Again, if you have one side that's really tight and the other side is more weaker. So this can be a little bit of trial and error to see what works best for you. Then, and you'll know too, like what you're dealing with because you'll notice either the pain improves or it gets worse. So that's where it can be a little bit of trial and error. Strengthening your core is going to be really helpful. The stronger your core is, this is also going to help with the pelvis stability. And then avoiding exercises like a butterfly, like a butterfly stretch, or anything where the knees are splayed apart because this can cause pain and discomfort at that joint. Because again, if you imagine splaying your knees wide, that's going to pull that joint apart in the front and cause discomfort. And then lastly, we want to think about addressing the pelvic floor. So just like with the adductors, how those can kind of pull on the pelvic bones, if you have some tight pelvic floor muscles, this can also pull at the pelvic bones and create, those imbalances. So looking at where you might have some tight spots, doing some release work. This can be where working with a pelvic floor PT comes in really handy because they can actually evaluate your pelvic floor muscles and see what's going on there. So, what is the outlook for SPD? For many people, it does go away postpartum, which is great. But for some, it can linger. I know for myself, after my first pregnancy, like I said, it went away immediately, and I really did not think about it again until I was pregnant a second time. But now I am 2 years postpartum with my second child, and every now and then I will feel it. I will say, it is nowhere near the intensity that it was at in pregnancy, like not even close. But every now and then I might feel a little twinge. And I tend to notice this more like if I've gone a longer period of not exercising. Like right now, I'm coming off of having 2 weeks off of workouts because I had walking pneumonia. So doctor's orders to not exercise. So I've done nothing for 2 weeks and I'm starting to notice, ooh, I'm getting some little twinges and flares there. And that makes sense to me because I haven't really been doing any strengthening. So things like that you'll start to notice maybe, but maybe not. This really does depend on the person, but I would say if you are still experiencing some of that pain postpartum, a lot of these strategies can still be really helpful. But if you are implementing all of these things, it's not getting better. You are, 1 to 2 years postpartum, you have stopped breastfeeding. I would definitely recommend seeing a pelvic floor PT for an evaluation because there is probably something deeper going on there. So that is our episode on SPD, symphysis pubis dysfunction. I hope you found this helpful. Like I said, if you are experiencing SI joint pain in your pregnancy as well, definitely be sure to go and listen to that episode. That is episode number 15. I will drop the link in the show notes. And if you are someone that is dealing with pelvic pain in pregnancy, remember, just because it is common does not mean it is something that you have to suck up and deal with. This is something that I help my clients with. I will say probably 80% of my clients have some sort of pelvic pain that we are working on, and they see great improvement with the right strategy and with the right exercises. You can also go see a pelvic floor PT. This is something that they specialize in, and really pay attention to those like lifestyle daily things that I mentioned, because even just making those small tweaks can give you a lot of relief. So if you found this episode helpful, be sure to share with a friend who might need it as well. Leave us a review, and we will talk to you next week.